If you've been told you have an L4, L5, or an L5, S1 disc bulge and you're trying to avoid surgery, this video is for you. In 29 years of practice, I've helped thousands of patients with lumbar disc bulges avoid surgery, and almost every single one of them came in with the same complaint. I've tried therapy, I've tried medication, I've tried injections, nothing is working, and now surgery is on the table. The reason most treatments stall is not because the condition is untreatable, it's because most approaches are not specific enough to what is actually driving the problem in your spine. In this video, I'm going to walk you through the exact 5-step non-surgical approach we use in our clinic to treat L4, L5, and L5S1 disc bulges. An approach that is specific, measurement-based, and built around your imaging, not a generic protocol. If you have a disc bulge and want to get out of pain, get back to living normally, and avoid surgery, keep watching. Hi, I'm Dr. Cordova, a chiropractor in Houston, Texas, with 29 years of experience helping people with chronic neck pain, back pain, poor posture, and sciatic nerve irritation. As a chiropractor, I believe the adjustment is the most powerful thing we do, and being specific with it matters, which is why I rely on spinal x-rays to guide every patient's care. On this channel, you'll get simple, specific, and safe strategies you can use at home to feel better fast. I share the same x-ray guided chiropractic strategies, posture fixes, and modern therapy insights I use in my clinic to help patients get long-lasting relief. Subscribe to learn how to take care of your spine, prevent flare-ups, and stay pain-free with clear, actionable steps you can use right away. When surgery enters the conversation, something shifts for most patients because surgery feels final. It feels permanent, and deep down, the real fear isn't just the pain. It's the thought of crossing a line you can't uncross. So let me ask you something. When you got that diagnosis, did anyone actually show you measurements on your imaging? Alignment changes, pelvic position, leg length differences, or did it move straight from here's what we see to here's what we should do next? You followed the instructions, you did the therapy, you showed up, and the pain keeps coming back. So surgery starts to sound like the only option left. Before we get into the non-surgical approach that we use, you need to understand why most patients for this condition stall before they ever get close to solving it. Here's something most patients are never told. Not all disc bulges behave the same way. Some push straight back, some shift to one side, some narrow the space where the nerve exits, some create instability. Others create stiffness, but most treatment plans treat them as if they're identical. And this is exactly where things start to stall. You go to therapy, you strengthen, you stretch, maybe you get temporary relief, but the leg pain comes back. The numbness returns. The back tightens up again. So the assumption becomes this must be severe. But severity isn't always the issue. The mismatch in treatment is. If the primary problem is lateral disc distortion compressing a nerve root, generic core exercises won't change that mechanical stress. If the issue is pelvic imbalance creating uneven disc pressure, stretching alone won't correct that load pattern. And if there's an underlying leg length discrepancy shifting how force moves through L5S1 and no one has identified it, the disc keeps absorbing uneven pressure every time you stand, walk, or lift. If treatment focuses on symptoms only, but the structural imbalances remain, the inflammation keeps returning. And when pain keeps returning, the next recommendation sounds more invasive. This is the turning point most patients don't recognize. MRI and medical x-rays are typically used to rule out something dangerous, a fracture, a tumor, severe degeneration. But what if imaging was used differently? What if instead of just using an MRI to confirm the disc bulge, we also took spinal x-rays to measure what the MRI never shows? Is the pelvis level? Is one hip sitting higher than the other? Is disc space narrowing more on one side? Is there rotational distortion contributing to nerve irritation? In addition, most patients have never heard leg length discrepancy discussed in relation to their disc bulge, yet even small imbalances in leg length shift how pressure distributes across L4, L5, and L5S1. And over time, that uneven pressure becomes disc stress. Disc stress becomes bulging. Bulging becomes nerve irritation, and nerve irritation becomes the pain traveling down your leg. So ask yourself this. Has your care been guided by structural measurements or by symptoms alone? Because if structure is driving the problem, structure has to be part of the solution. And the first thing that is required is something most patients have never done, a precise structural measurement of their spine. And that is exactly what we do first. Before we adjust anything, before we decompress anything, before we recommend anything, we measure. We start with a thorough examination. That includes posture analysis, spinal mobility testing, and a neurological evaluation to assess nerve function, reflexes, and any sign of nerve compromise traveling down the leg. This tells us how your spine is functioning under load and where the breakdown is actually happening. Then we take precise x-rays, not just to rule out fracture or disease, but to map your structure, alignment patterns, pelvic positioning, disc space height, lumbar curvature, rotational shifts, subtle asymmetries that change how force travels through L4, L5, and L5S1. Because if force is uneven, pressure is uneven. And uneven pressure over time is what stresses discs. We also assess for anatomical leg length discrepancy. This is something most doctors never measure, and it matters more than most people realize. Here is why. If one leg is structurally shorter than the other, even by a small amount, it creates an unlevel sacrum. And when the sacrum is unlevel, the foundation your entire lumbar spine sits on is tilted. That tilt creates abnormal load patterns directly at L5S1 and L4, L5. Over time, those uneven loads don't just cause discomfort, they contribute to disc stress, disc bulging, and nerve irritation. To measure this accurately, we take true leg length x-rays to assess actual anatomical leg length, not an estimate, not a visual guess. A precise measurement that tells us whether leg length discrepancy is contributing to what's happening at your disc. Has anyone ever done that to you? Most patients say no, and yet it can be one of the most important findings in the entire evaluation, because a few millimeters of sacral unleveling matters in your spine. Most patients have never seen their spine evaluated in this way. They've been told you have a bulge, but they haven't been shown whether their pelvis is level, whether one hip is higher, or whether a leg length discrepancy is shifting load every single time they stand or walk. Generic care treats symptoms. Precise care measures structure and lets those measurements guide every decision that follows. And that's exactly what makes step 2 possible. Targeted chiropractic structural correction. Now here's where most treatment approaches miss the mark. Think about every treatment you've tried. Therapy, stretching, medication, maybe injections. Did anyone tell you exactly which spinal segments were misaligned and which specific adjustments were being made to correct them? Or did it feel more like a general approach applied to your general area of pain? That distinction matters more than most people realize. Once we know exactly where the misalignments are, both locally at L4, L5 in the sacrum and globally throughout the entire spine, we begin correcting them with specific chiropractic adjustments guided by the very x-rays we took in step 1. We use those x-rays as a roadmap, so every adjustment is intentional and precise, not based on feel, not based on guesswork, based on what we measured. And here's why that matters. When L4, L5, or S1 are not moving or positioned correctly, the nerve roots and disc tissue in those areas stay under constant mechanical stress. That stress doesn't just cause pain, it prevents healing. And that is why so many patients get temporary relief, but never actually turn the corner. But when alignment and motion improve at those exact levels, something shifts. Pressure on the disc decreases, inflammation begins to calm, and the body finally has the opportunity to heal in a way it couldn't before. This is where many patients start noticing real, lasting changes for the first time. But here's what most people don't expect. Correcting alignment is only part of the solution, because when the structure improves, there can still be internal disc pressure that needs to be addressed directly. And that's where step 3 comes in, non-surgical spinal decompression. Here's something most patients don't know exists. Even when alignment is improving through specific chiropractic adjustments, there is still a separate problem happening inside the disc itself. And no amount of adjusting directly addresses that. Think of it this way. If the disc is bulging and pressing on a nerve root, alignment correction reduces the abnormal load on that disc, but the pressure already built up inside the disc doesn't automatically disappear. That internal pressure is what keeps the bulge pushing outward, and that is what spinal decompression directly targets. So how does it work? Non-surgical spinal decompression gently and precisely reduces pressure within the disc space. And when that internal pressure drops, something important happens. The bulge disc material begins to retract away from the nerve root, not through force, through controlled negative pressure that creates the right environment for the disc to decompress and begin healing. But here's what makes our approach different from generic traction. We make our decompression recommendations based on what we see on the MRI, because not every disc bulge needs the same approach. For some patients, the decompression chair pulls straight out and holds that position, allowing the disc space to open and internal pressure to gradually decrease. For others, we have it pull straight out, return back 25%, then pull straight out again, then back and forth motion stimulates fluid exchange and helps the disc rehydrate more efficiently. And in cases where there is a lateral disc distortion or asymmetric narrowing, we use a side-to-side pull to specifically open up the disc space on the affected side. Have you ever been told that spinal decompression is an option for your disc bulge? Most patients haven't, and if you have had it done, ask yourself this: was it ever customized to what your MRI imaging actually showed, or did it feel like the same machine doing the same thing regardless of what your imaging showed? Because that distinction is exactly what separates temporary pressure relief from actual disc healing. Many patients begin noticing a reduction in symptoms even after the first few sessions of spinal decompression, but reducing pressure is only part of the recovery, because even when disc compression improves, inflammation inside the tissue can linger and slow everything down. And that's where step 4 comes in: calming the inflammation directly. Here's where most treatment plans stop short, and honestly, this might be the step that explains why you have not fully recovered yet. You can correct alignment, you can reduce disc pressure, but there is still something happening at the cellular level that mechanical treatment alone cannot fully address. Have you ever felt like you were making progress, but you just could not get over the hump? Pain improves slightly, then plateaus. Feeling better after a session, then waking up the next morning with the same familiar discomfort. It is because inflammation is still occurring in the background. When a disc bulge irritates a nerve root, inflammation builds up around that tissue, and here's the problem: even when mechanical pressure begins to improve, that inflammatory response can linger. It keeps the nerve hypersensitive, it slows tissue repair, and it quietly prevents the kind of recovery that actually holds. That is where PEMF comes in: pulsed electromagnetic field therapy. PEMF works at the cellular level. It uses low-frequency electromagnetic signals to support cellular energy production, improve circulation, and reduce inflammation in the affected area. And for disc tissue specifically, this matters more than most people realize. Here's why. Disc tissue has very limited blood supply, and that is one of the main reasons disc bulges heal so slowly. There simply isn't enough circulation to deliver the tissue needs to recover. PEMF helps stimulate cellular repair processes in these low healing areas, supporting disc recovery while calming the inflammation surrounding the affected nerve roots. Has anyone ever explained to you that disc tissue has limited blood supply and that is part of why you are not healing? Most patients have never been told that. Think about what that means for your situation. Spinal alignment is improving through adjustments. Internal disc pressure is decreasing through decompression. And now, at the same time, the inflammatory environment around the nerve is being calmed at the cellular level. When was the last time a treatment plan addressed all three of those things at the same time? For most patients, the answer is never. These three things working together create a very different outcome than any one of them working alone. Patients consistently tell us that this is their favorite part of the visit. It is comfortable, it is relaxing, and many notice a reduction in pain faster than they expected. But here's what matters most about this step. PEMF doesn't just help you feel better in the short term. When combined with structural correction and decompression, it helps lock in the results and support long-term healing instead of temporary improvement. Because feeling better is one thing, staying better is another. And that is exactly what step 5 is designed to protect: stabilizing the correction and preventing future disc bulge episodes. Here's the step that determines whether everything we have built actually holds, because your body spent months, possibly years, moving in patterns that contributed to this problem, and those patterns don't just disappear because your structure is improving in the clinic. If nothing reinforces the correction outside of your appointments, the body defaults back to what it knows. Old movement patterns recreate old stress, and old stress recreates the same disc pressure you work so hard to reduce. So we give you specific home exercises based directly on what we found in your exam and x-ray findings. Not generic stretching, not a standard routine, exercises chosen for your structure specifically. If your pelvis was tilted, we addressed the muscular imbalances contributing to that tilt. If there was asymmetrical load at L5-S1, we reinforce balanced movement patterns so pressure does not shift back to one side. Have you ever been given exercises without anyone explaining why those specific ones were chosen for you? Most patients have. And most stop doing them because nobody ever connected the exercises to their specific problem. When you understand why each exercise matters for your spine specifically, you actually do them. And when you do them consistently, alignment stabilizes, disc stress stays reduced, and flare-ups become less frequent. If you've made it this far, here's what I want you to take away from this. You are not out of options. In this video, you just learned about a structured, precise, step-by-step approach where each step builds directly on the one before it. Measurement guides the corrections. The chiropractic adjustment improves the structure. Non-surgical spinal decompression addresses the disc directly. PEMF calms the inflammation, and targeted exercise reinforce everything so the improvements you made hold. That is what a true multimodal treatment approach looks like. Not one thing tried in isolation, all 5 working together, guided by your imaging, built around your structure. Consider looking for a chiropractor or health professional who can take you through these 5 steps. You deserve to know exactly what is happening in your spine and exactly what is being done to correct it. That is where fear ends and real confidence begins. If this video gave you clarity and made you feel like there is a real path forward, like and share it. It might be exactly what someone else needs to hear right now. If you have any questions about the 5 steps, drop them in the comments below. I read and respond to all comments. And if you want to keep learning how to take care of your spine, prevent flare-ups, and stay pain-free with clear, actionable tips you can use right away, make sure you subscribe. Now, in the next video you should watch is this one, where I walk you through the 5 safe, advanced L4, L5 disc bulge exercises for quick relief. Go watch that one next.